Hello, my name's Dr. Scott Payne. I am a consultant in addiction psychiatry working in the Western Health and Social Care Trust. The service that I work for covers across the whole of the Western Trust. We have bases in Derry, in Omagh and in Enniskillen, mainly seeing patients in the community as outpatients, but we have a small 7-bedded inpatient rehabilitation unit that's based in Omagh. The staff in the team consist of doctors, psychiatric doctors, psychiatric nurses, psychiatric social workers. We have hidden harm workers who work with the children and the families of our patients. We have nurses that work in the hospitals in Altnagalvin and in the Southwest Acute Hospital, working with patients on the wards there. We have detox nurses who work in the community, supporting GPs and supporting patients to undertake community alcohol detoxes, or if necessary, with the support of going into a hostel, either Damien House or Ramona House, or being transferred into hospitals if required. We also have therapists who work in the police stations, working with people who've been arrested, picked up by the police, who may have a drug or alcohol problem there. The type of patients that we see: basically anyone with an addiction issue, an addiction problem, whether that be with alcohol, with drugs, or behavioural addictions such as gambling. People who haven't been able to sort those problems out either themselves, with community support, through their GP or their family. So someone who needs a bit more specialist help. They'll probably get referred on to ourselves. The referral process is to get a letter from your GP, and then we will see anybody that's referred in by the GP. If you come to our team, what you would expect, you get to meet a therapist, do an assessment. The initial processes would be things like doing educational work, offering support to yourself and to your family around what an addiction problem is about. We then offer a range of talking treatments, whether that be motivational counselling, developing coping skills, relapse prevention work, helping people stay off substances after they've come off. Working with families, we do work on developing people's what we'd call social networks, helping the people around the individual with the problem, support them to stay off their substance and to move forward with their lives. We also link in with other community resources, including self-help networks such as AA and Al-Anon, which is a support service linked to AA that supports families. We also provide prescribing options through the medics in the team. That would include medication to help somebody detox off alcohol or off drugs, and medications that help people stay off the substance after the detoxification.